from MerseyCare NHS Trust. We're part of Rebuild Clinical Business Unit, and we've come to the Expo to talk about human rights and healthcare. We've been involved in a pilot project looking at risk assessment and management, so we're basically here to promote that.
Basically what we've been doing is looking at aspects of human right-based approaches of how we can empower service users, make them more aware of people's human rights. So we've developed a number of practical tools so that human rights become real for people. In terms of risk assessments, we've developed human rights-based risk assessments which look at the human rights attached to the risk area and the human rights attached to the management of that risk, and also the human rights attached to the wider community. From there you come up with a balanced decision making which aids your care plans, and it helps you with proportionate responses in terms of interventions, which, because traditionally risk is done to people, not with people, and it really empowers service users, makes a big difference in their lives. We've also developed Standing Up for My Rights group, which is looking at the articles of the human rights and the freedom principles, fairness, respect, equality, dignity and autonomy, and looking at how those freedom principles can be related to a person's life. People who use our services, we give examples of each of the articles, and it makes it very real for people. So rights aren't something that's distant and some dusty old UN charter. It's something that's meaningful and can make a difference to people's lives.
Any key messages that you want to?
Yeah, I think one of the key messages around this is a real way of enabling people and empowering people to lead positive lives in the community. A lot of the people who we work with are people that have got negative reputations or have been in secure services for a long time. And what we find is by using this process and by engaging people, is there's less likelihood of people being offended, and they're also going to stay in the community for a lot longer than is expected. So all round it's a really positive approach to working with people.
Also the cost is reduced as well. The cost of these packages of care, you can show that the third sector, the agencies, staff require less staff over the years, so the person becomes more empowered and it takes more control of their life. And also the cost of relapse, because we know so much more about the service users because they're involved in the whole process, that the relapses are very much reduced as well. So everybody's on a winner, and it fits all the CQC guidelines and equity and excellence liberating the NHS, New Horizons, what have you, and key performance indicators. So everything's ticked as well.
And finally, our trust is now the lead trust for human rights and healthcare nationally, and we're really keen to hear from other people who want to launch similar initiatives where they are. So get in touch with us. We're keen to share our experience and help you think about service user inclusion where you are.